Hi, I'm Shahina, the psychologist with the 7 to 17 Family Mental Health Program. Thanks for joining us for the parent group called Mixed Emotions. You're probably watching this video because your child or teen has been expressing some really big feelings. You may have noticed that they're expressing feelings of anxiety, feelings of being overwhelmed, or an overall low mood. Throughout this video, I'll try to help you understand these feelings and provide some strategies to help your kid work through them. In person, this group involves a lot of activities. I will try to include them here in this video. To prepare, I just ask you to pause the video so you can grab some paper and pen so you're able to participate at home.
When looking at these pictures, can you guess the child's feelings? It's easy to assume a number of things, or just not know what's going on. And in the case of a teen, it might be hard to tell. It is important as parents to think of the many factors which may arise when addressing the feelings of your child.
This is our first activity. I like to start with this activity to acknowledge what's going on in our lives, focus on the present, and prepare ourselves for group. There is likely a lot going on in everyone's lives, kids in the other room, work calls, desire to be a perfect parent, or even assumptions about this presentation. But for the duration of this video, I'd encourage you try to let go of some of it. So imagine writing on each of these balloons something that you want to let go of to be fully present in group today.
I just like to emphasize that stress is normal. It's a part of our everyday lives and we all experience it. It signals us in the face of a new challenge and points out areas in our lives where we may need to make a change. This slide talks about depression and some of the symptoms associated with being diagnosed with clinical depression. Some reminders are that there is a difference between feeling depressed or sad and being diagnosed with depression. There is also a difference between feelings of grief and loss and a diagnosis of depression. You can pause the video here and read through some of the symptoms of depression. Keep in mind that to receive a diagnosis of clinical depression, an individual would show 5 or more of the symptoms listed for at least 2 weeks. Now we'll talk a little bit about anxiety. Everyone feels anxious or overwhelmed in some situations. It may help us stay focused in certain stressful situations, but when the challenge has passed, typically the anxiety does too. Some stressors are harder to identify, like friendship or relational issues that don't have a clear start or finish compared to a presentation. These can result in anxiety that appears more general. However, as these stressors pass, so too should the anxiety. If you're noticing that these symptoms of anxiety are lasting weeks or months or even longer, it can be a sign of anxiety disorder.
This brings us to our second activity. Yellow lights are what we call soft signals or warnings that tell us that we need to make a change in our lives. They can be signals in our bodies or our lives. Examples could be biting our nails, twirling our hair, running out of gas, skipping meals, eating out a lot, watching more TV than usual. Pause the video now to write down some of your yellow lights. Then think about some of your child or teen's yellow lights.
We will now go into some of the treatment options and strategies to work through anxiety and depression. As we go through some of the strategies, I want you, as parents, to think about how much you are currently engaging in these strategies and what could be holding you back. I'd like to emphasize the importance of modeling and impact parents have on their children. Our children often mimic our behaviors.
Before we start going into the strategies in more details, I'd encourage you to draw 6 of these rating scales. As we go through each of the strategies, I'll ask you to pause to take a couple minutes to think about where you and your child sit on the scale for each of the strategies. I'd also challenge you to think about what is getting in the way of having this number higher.
Our first treatment strategy is social supports. It's really important for you to know and understand who your supports are and how to access them. This includes teaching your children and youth who their supports are and how they can access them also. Some of the importance of social supports are that it increases confidence, it helps us achieve our goals, and it decreases alone time. On the slide, you'll find some examples of informal supports as well as some formal supports.
For this activity, I'd like you to draw two circle diagrams like the one displayed on the slide. The one displayed on the slide is filled in for me. Uh, the innermost circle are people that I am most emotionally connected to, who I would tell my biggest secrets to. As we move out to the outer circles, those are people that I am less connected to. After you fill out this circle diagram for both you and your child, take notice about your circle compared to your child's circle. Children often mirror the support of their parents. For example, an adult who has very little support may assume that their child or youth also does not need as many people in their lives. Do you notice any other themes that may need some adjustment?
Using the scales you'd drawn earlier, I want you to think about the social support activity you just did with the circles and take a couple of minutes to fill in this rating scale. Try to make a mark for both you and your child. Also, think about what could be getting in the way of making this number higher. Daily physical activity is also very important in helping to manage symptoms of anxiety and depression. Encouraging your children and youth to engage in 60 minutes of physical activity will likely help to increase mood with the release of feel-good brain chemicals called endorphins. On the slide, you'll notice some of the things that physical activity can help with. Once again, I'd like you to go back to the scale you guys had drawn and put a mark where you and your child would fit in terms of physical activity. Take some time to notice if you need to make any adjustments in this area. For example, maybe some less screen time, maybe encourage a little bit more outdoor play. To understand the benefits of informal physical activity as well as formal physical activity. Nutrition and the food we eat are also important in managing symptoms of anxiety and depression. Healthy eating is one of the ways to help balance mood, cope with stress, and stay focused. We do emphasize fruits and vegetables, whole grains, healthful, unsaturated fats, and good sources of protein. This doesn't mean we shouldn't include some treats throughout our day. We are in charge of what's in our fridge. So think about if you need to make any adjustments in these areas. As parents, we stock and set out items and our children decide how much to eat. Think about the nutrition and eating habits in your home and take a couple of minutes to fill in this rating scale. Like we talked about earlier, stress is unavoidable and a part of our life. Building in daily relaxation can be protective. Talk to your children about what you like to do to relax. Help your children find activities they enjoy that they find relaxing. Take out time in the day to encourage all family members to engage in these activities. Take a minute to fill in this scale on relaxation. Think about the time you take out of your day to engage in relaxing activities, and the same for your child. Good sleep is important in helping to manage our moods. The numbers on this slide are general guidelines. Some signs that could identify a sleep problem include daytime sleepiness, mood changes, possibly being more irritable, problems paying attention, problems with memory, craving junk food, taking longer than 30 minutes to fall asleep. Some good sleep hygiene tips include bedtimes within a general half an hour time frame, reduce blue light, increase your physical activity, less caffeine and pop, sleep with reading, or quiet activity versus screens. Fill in this rating scale according to your sleep and your child's sleep. What gets in the way of better sleep? Engaging in creative activities has been shown to help with symptoms of anxiety and depression. Being creative can be calming by slowing down breathing, heart rate, and blood pressure. Keep in mind, it's not about having talent, but exploring something that you enjoy doing. The final rating scale I'll have you fill out is for creativity. How much creativity is nurtured in your home? Is it different for boys versus girls?
After going through these strategies, I'd like you to reflect for a couple of minutes. Take some time to write down answers to the questions on this slide.
Before ending the presentation, I'd like to chat a little bit about screen time. Screen time is a common challenge in most families. Kids and youth tend to be on screens for longer times because it keeps them distracted, happy, and relaxed. But this, in turn, may cause a rebound effect. Screens reduce movement and create irritability after long periods of time. We also have to look out for an inflated sense of connection when the youth needs exposure to social skills and unconditional relationships. We may also see reduced sleep from waking up and texting or secret gameplay after parents have gone to bed. Increased screen time can be an example of a yellow light, when real person interactions become less important than screen interactions, or you're noticing conflict when it is time to turn screens off. A couple strategies that we like to share is once a day play. So the child decides the time of day, and parents decide how long the child gets to play versus earn time. So, for example, a child may decide they want to watch TV first thing in the morning, but with the rush of getting ready and getting out the door, they may only have 5 minutes at that time, but they can enjoy maybe 30 minutes if they wait till after their homework in the evening. It is also important to talk to your children about safe internet practices.
To finish off, I'd like to challenge each parent to spend 15 minutes every day with your child or teen. This is individual, undivided attention, no phones, doing something that they'd like to do. We often do this with younger kids, but find it difficult with teens who may seem uninterested, but teens will benefit from it too. The 7 to 17 Family Mental Health Program thanks you for joining this virtual group. We hope that some of the strategies in this video will help you, your child, or your teen.